Hey all, welcome to my channel, and if you're the person that's trying to sleep next to the snorer, you know how hard it is to fall asleep when all you hear is this loud, obnoxious noise. So today, we're going to answer that question. We're going to teach you how to stop snoring. If you like what you see, make sure you share this with your friends so they too can learn about their health. So let's get into the video. Let's talk about snoring. First of all, let's review what exactly is snoring. So whenever you breathe through your nose or through your mouth, the air creates some vibrations in the upper airways, which causes this sound that we call snoring. That being said, there are two main reasons why people start snoring. One is because their tissues of the upper airway are vibrating because they're relaxed. You can think about when you sing, right? You take a breath, then you breathe out, and the air comes from your lungs, goes through your vocal cords and vibrates them and makes noise. Well, same thing happens when you breathe through your nose and your mouth when you're sleeping. And also, the other reason why people start snoring is because their upper airway is actually narrowed by some anatomical reason, usually obstruction from your nose or from your throat. Alright, so now that you understand why people snore, let's talk about the medical term for snoring. So you might have heard your doctor use one of these terms, OSAS, UARS, or just simple snoring. So OSAS stands for obstructive sleep apnea. UARS stands for upper airway resistance syndrome. And then there's simple snoring. So obstructive sleep apnea is defined as you having pauses in your breathing during sleep more than 5 times an hour. This is serious because when your breathing stops, you stop getting oxygen, and that can be dangerous. Sometimes you may actually choke, and that is called an apnea, hypopnea, index of 5 or higher. It's apnea and hypopnea. Hypopnea means a reduced amount of airflow. So you have a pause in your breathing that is more than 30% and lasts at least 10 seconds. Apnea means complete cessation of airflow for more than 10 seconds. So that is our sleep apnea. People who have OSA often have very loud snoring. Sometimes they will stop snoring and then restart very abruptly. They often have very dry mouth in the morning because every time they take a breath after stopping, they kind of gulp down the air and that dries the mouth out. Also, they tend to have a lot of unrefreshing sleep. And if you ask them, they will say, I wake up a lot at night. I don't really feel refreshed in the morning. I still feel tired. Also, you might have noticed in the morning your spouse has a slightly bluish tinge to their lips and their skin. And that's because every time they stop breathing, they're not getting enough oxygen, and so their tissues become a little bit bluish. You may also notice that they wake up choking. The second condition is UARS, or upper airway resistance syndrome. And this is defined as having a respiratory disturbance index of more than 5 but less than 15. So it's not quite sleep apnea, but you do have a number of pauses in your breathing that could cause you to not get a good night of sleep. The symptoms are very similar to sleep apnea, but it's less severe. You might find that you're still a little bit tired in the morning, a little bit difficult to concentrate during the day, still have some dry mouth, but generally not as bad as sleep apnea. And then there's simple snoring. So this is when you just have that vibration of the tissue, because your muscles are so relaxed that the upper airway becomes narrower and the air vibrates the tissue as it goes through. So simple snoring is much more common than the other two conditions. And it's usually something that is annoying, but it doesn't have any real medical significance. Alright. So now that you understand the different types of snoring, let's talk about how to treat snoring. So if you're a simple snorer, right, your snoring is caused by that vibration of the tissues when you relax. There are many things you can do at home to try to limit that vibration. First and foremost is lose weight. So if you're overweight, losing even 10 pounds can really help decrease your snoring, because you're recarrying all this extra fat around your neck, and it narrows your upper airway. So simply losing that weight can help reduce the size of your airway and reduce the amount of snoring. The next thing you can do is avoid alcohol before bedtime. Alcohol is a muscle relaxer, which means when you drink alcohol, your muscles become very relaxed, including the ones in your upper airway, and so that can exacerbate your snoring. So try to avoid drinking within 3 hours of bedtime so you can sleep without that muscle relaxation from the alcohol. The third thing you can do is try to sleep on your side. When you lie on your back, gravity pulls all the fat above your neck down, and that narrows your airway. So when you're lying on your side, you tend to open up the airway a little bit more, and that helps reduce snoring. And the fourth thing you can do is try to use a nasal dilator. A nasal dilator is basically something that opens up your nose. And when you breathe through your nose instead of your mouth, you'll produce less sound because the air is going through a narrower passageway. So that produces less vibrations in the air and less noise. And the last thing you can do if you're a simple snorer is try to do a tongue depressor exercise. So this is basically where you put your tongue against the roof of your mouth and you push upwards. As you push upwards, you'll feel some resistance and you try to keep that tongue elevated throughout the day. What this does is over time, it strengthens the muscles that hold your tongue down, and when you're sleeping, your tongue will be less likely to fall backwards and block your airway. Now let's move on to the next group of people who have enlarged tonsils or adenoids. If you've seen my videos on tonsillectomy, you'll know that enlarged tonsils can cause a lot of problems, especially when you're sleeping. So if you have enlarged tonsils, the best treatment for you would be a tonsillectomy. In fact, I've done a video on this before, and I've had patients who had massive tonsils, bigger than a child's tonsils, and after removing them, their snoring goes away. The other thing you can do if you have enlarged tonsils or adenoids is get the adenoidectomy. An adenoidectomy is removal of the adenoids. Adenoids are located deep in your nose, behind your nasal passage. They are part of your lymphatic system, and they can enlarge and obstruct your breathing. So children who have a lot of recurrent infections with their tonsils and adenoids may benefit from an adenoidectomy. And again, this is something that you can discuss with your ENT surgeon. The third reason you might be snoring is because your nasal passages are obstructed. This can be caused by a deviated septum, which is a bump in your nose that is causing narrowing of your airway, or it can be caused by enlarged turbinates. Your turbinates are these bony structures on the side of your nose that have a lot of mucous membrane on top of them, and sometimes those can become enlarged and cause obstruction to your breathing. And the last thing it can be caused by is chronic inflammation of your sinuses. So this can be caused by allergies, it can be caused by polyps, it can be caused by other infections. All of these things can cause inflammation in your sinuses that narrows your upper airway. So if you have this problem, the best way to treat it is to see an ENT surgeon, get an endoscopy, look inside your nose, and determine whether you need surgery or not. For example, if you have a deviated septum and it's causing you a lot of problems, you may need a septoplasty, which is surgery to remove that bump and open up your airway. If you have chronically inflamed turbinates, you might have a turbinate reduction. That is where we reduce the size of the turbinate to allow more air to pass through. And if you have enlarged inflamed adenoids, you may need an adenoidectomy. And the last reason you might be snoring is because you have very thick, stiff nasal secretions. You can have this from allergies, you can have this from a deviated septum, you can have this from polyps. Any of these things can cause these thick, sticky secretions that when you breathe through your nose, it makes that suction noise, and that's called a rhinolith. And the easiest way to treat a rhinolith is to get it irrigated out. So see an ENT surgeon, get a saline irrigation of your nose, and that should clear out that mucus plug and help you breathe better. The last group of people are those who have obstructive sleep apnea. So I've made a video on this before, and I've done a CPAP titration study. Basically, the treatment of choice for obstructive sleep apnea is CPAP. CPAP is continuous positive airway pressure. And basically, you wear a mask at night while you sleep, and it pushes air continuously through your nose or through your mouth to keep your upper airway open. You may also have additional treatment options such as oral appliances that you can wear at night, which are like mouthguards that are custom fitted to hold your lower jaw forward to open up your airway. Another option is a positioner, which is a special pillow that keeps you from lying on your back, because that tends to make the apnea worse. And the last treatment option is surgery. Surgery is reserved for people who can't tolerate a CPAP machine, who have very severe apnea, and only about 65% of people who undergo surgery actually end up having a good result. The most common operations include an adenoidectomy. If you have enlarged adenoids, a tonsillectomy. If you have enlarged tonsils, and a uvulopalatophoroplasty, which is a soft palate operation to remove some of the tissue on the soft palate and the base of the tongue to open up your upper airway. Alright, so hopefully now you have a good idea of how to treat snoring. And remember to subscribe for new videos each and every week. While these tips can significantly reduce snoring, it's important to remember that persistent snoring might be a sign on an underlying health condition. If you find that these methods aren't effective, please consult a healthcare professional for personalized advice. Thanks for watching.